Welcome to today's episode of Navigating Nursing School with your nursing tutor. Today, we're going to be talking about all the things that your nursing professor doesn't tell you about nursing school. And to help us pull back the curtain and reveal those secrets, I have a special guest to introduce you to today. Her name is Justine Bailey, and she's a registered nurse and a passionate nurse educator from Ontario, Canada. She's worked in nursing practice, education, and leadership for over 15 years. And apart from teaching, she's also a nurse entrepreneur, just like me. So her business, Just Like That, utilizes social media, content creation, and coaching to educate and empower nurses and nursing students from diverse backgrounds to lead meaningful lives and professional careers. Welcome to the show today, Justine.
Thank you for having me. I'm so excited to be here.
Yeah, me too. I'm so glad we connected on TikTok.
I've been following you for a while, so I'm so glad you reached out.
Yeah, well, I'd been following you for quite a while too, because I love how upbeat and like encouraging your content is. And I'm always looking for that because, as we both know, we need more of that in the nursing profession, and especially, helping out the future nurses that are coming up in the next generation. So regardless of their age, I should say, because I work with a lot of adult learners. And so when I say next generation of nurses, I'm not talking about like baby in age, but baby in their career. Yeah. So another thing about me, though, that I think we really connected on is that I am always trying to be, as a nursing tutor, and I always tell my students too, they're surprised to learn that I'm more of a nursing school coach. And I know you're big on coaching nurses and nursing students as well. And I always try to walk the line between nursing students and nursing instructors, because as we both know, there is a ton of frustration between these two groups, with nursing students feeling like their instructors are often out to get them, are making things hard on purpose, get frustrated with questions that seem like they just don't know, like they're just asking for basic help, they feel like, as a student, but the professors get frustrated. Whereas on the other hand, I have also gotten a peek into the professor's world and how difficult it can be from the nursing professor side, and what kind of expectations you're dealing with, and struggles and lack of pay and things like that, and how, but deep down, you really do want to help the nursing students. And it just kind of sometimes gets lost in translation on both sides. So today, I know we're going to be talking about some of that. And I know that a lot of the things you have, the secrets that you have to share with us about what nursing instructors won't always tell their nursing students, will give our nursing students a little bit of that insider's perspective, so that they can have a little more, maybe even empathy for their nursing instructors, but also more importantly, know how to communicate with their instructors a little bit better. Because I firmly believe, and I think you'll agree with me, that when you understand the other person you're trying to communicate with, it's going to be easier to get your point across. And let's be honest, like, get what you want out of the conversation. So so I know you had some tips to share with us.
Yeah, and thank you for that segue, Nicole, because I think oftentimes, like you said, there can be this tension between students and instructors. Instructors are there to teach and facilitate learning. Students are there to learn, graduate, pass the course, what have you. And sometimes, well, let's be honest, a lot of the times there is this struggle of give and take. And I think a lot of it has to do with just the way our profession has always been. Like, there's just this traditional way of viewing professors. They know it all, and I need to, do what they say because they've done it right. They paved the way. They know what it's like. But there's some things that students, and this is the reason why I want to come on here. I think getting a better insight and understanding of what your instructors and professors go through can help you a little bit in terms of navigating nursing school, having those difficult conversations, like you said, getting what you want, right? At the end,
Within reason.
and just overall making the experience of nursing school a good one, because it's already stressful. It's already the amount of work and content and the demand that is put on students is already stressful enough. So I think when you have a better understanding of your profs and what they're going through and why they say the things they do, why they act the way they do, you get a better understanding and hopefully develop some ways to navigate around that. So yeah, I'm here to share with you today what your nursing profs don't tell you. And hopefully give you a little bit of insight and maybe some strategies about how to move forward in your nursing school as you're dealing with your different courses and labs and talking to preceptors and instructors. So yeah, I'm happy to dive in.
Yeah. Why do you think the nursing instructors don't usually share some of these things up front with the students?
Oh, that's a great
I know
question.
I just threw that on you. So
Yeah, it's kind of like that hidden curriculum that they don't really want to show. They don't really want to show the kind of, you know, the tougher sides of nursing school and being a nursing educator. They a lot of times we have to put on a mask, right?
Mhm.
Or show what they say, like fake it till you make it, right? We got to
Yeah.
show that we are in control. We're powerful. We're the experts. We're credible. But really, we struggle too. Like,
Yeah.
and that's part of it too. Is I want students to see that like we're struggling, albeit different things. We're struggling in different ways too, and we're just trying to make it and trying to do the best that we can in the same way that students are.
It
Um,
sounds like nursing instructors have imposter syndrome, or just as likely to have imposter syndrome as the nursing students are. And I think that's important to remember.
yeah,
Everybody struggles with it if you're alive. Yeah.
yeah, exactly, exactly. I know when I got into nursing education, I struggled with that, and even up to now, even with the experience that I do have, I still get
Hmm.
nervous when I go into class and I think, oh my gosh, are students going to think I'm credible, or are they going to think I know enough, or I'm knowledgeable enough, or I still struggle with that, right?
Yeah.
So which leads me to my first point, or my first kind of insight that I want to share about nursing instructors, and that is we're not always experts on the topics that we're teaching. Like
Hmm.
that's the reality, right? Like I teach, for example, nursing lab. Okay, so I'm teaching things like all the psychomotor skills, like taking vital signs and starting IVs and trach care and wound care, and but I've been out of practice for the last 10 years. I probably haven't touched a patient in the last 10 years, and I'm not an expert in, let's say, wound care,
Right.
but I still need to teach it, right? And so I think a lot of times the students assume that I would be the expert in it because I'm teaching it. But
Hmm.
times that's not the case. We are learning it probably weeks in advance before teaching it. Like so if I have a wound care class, I'm prepping for it 2 weeks in advance, and that's even, generous. Some
Oh, yeah.
instructors might prep the day before,
Wow.
right? Because there's not enough prep time given for instructors. That's a whole other issue in and of itself. But I want students to realize that we're expected to teach you different concepts and topics, but we may not always be the know-alls or the experts
Hmm.
in that. We're learning it oftentimes, or reviewing it, or refreshing our memories um, as we go, right?
Yeah.
And and so when you ask a question in lab, and and your instructor doesn't know or struggles to provide you with the answer you're looking for, keep that in mind too. They're probably drawing on information and experiences that were, in my case, 10 years plus ago, because
Hmm.
I haven't done wound care in 10 plus years, right? So I think that's an important aspect to keep in mind.
Yeah. Yeah.
Uh,
I mean, talking about imposter syndrome, I feel that way too, even after having been a professional nursing tutor for 15 years. Like, I still get students asking me questions, and I'm like, I don't know the answer to that. Now, when I'm tutoring, or I'm in my membership, my group tutoring membership, I've learned with experience,
mhm.
tried to get a little more secure in
Yeah,
myself, but to be honest with that, because at the end of the day, I don't want to tell them something wrong.
yeah,
And so I will be like, either I'm not sure, I'll get back to you, which is
yeah.
also a great parenting hack I've learned when my kids ask
That is,
difficult questions I'm not prepared to answer. But I've actually started teaching my tutoring students, like when I'm in a situation like that, I'm like, let me show you how I figured this out. And a
Yeah.
lot of times I pull up Google and I'll share my screen and I'll be like, this is the what we're trying to figure out. So this is the question I'm going to put in there. And this is how I evaluate the answers to look for, what we're getting and to determine whether it's a good answer or a bad answer, and how we verify it in the textbook and things like that. So
Yeah. Yeah.
yeah,
And that's great role modeling that you're doing with
I hope
your,
so.
because
Yeah.
in the real world, when you're an actual nurse and you don't know the answer to a question, how do you find that information? Because the reality is you're not going to be an expert when you graduate from nursing
Nope.
school
Just a
either.
safe, effective beginning nurse.
That's right. So you're going to come into situations where you're not going to know, you're not going to be sure. And so do you have the skills to find the information that you need? And I do the same thing even in my role as an educator. If I don't know the answer to something, it's kind of like, you know what? I'll be honest. I don't know that answer. But either I'll get back to you with it or come, let's look it up together. Let's go in the textbook. Let's look together and figure out. And then there's that partnership that you create as well
Yeah.
when you do that, right? So yeah, great example. The other thing I want to share with students about being an educator and the things that we don't tell you necessarily is that we don't always we're not always on top of the issues and trends at the bedside, right? So
No.
many of us have been outside of clinical and haven't touched a client or been, exposed to sort of clinical settings in a while, right?
Mm.
And so things are not as fresh for us, and we can't always keep up with the issues and the trends that are happening. I'll give you an example. So um, in one of the classes, we were talking about anemia, right?
Hmm.
And it just kind of, pathophysiology behind it and da da da. And then the students talked about, being clinical and being a part of providing iron infusions. When I was in practice, I never did
Didn't
iron.
do
It
that. Yeah.
was blood transfusions that we were doing. Right?
Uh,
I worked in a
yeah.
MERS, right?
Yeah.
It was blood transfusions. And here the students are talking about iron infusions. And in my head, I'm like, I know nothing about this.
You know, you're like, I
My
don't know if this is right or if this is wrong.
I how my students are now teaching me. So I
Hmm.
learn about what's happening at the bedside through my students,
Yeah.
right? But I never said that out loud, right? But I'm
Right.
having a conversation.
Uh-huh.
Having a conversation. But that's just an example of like, I can't keep up. So a lot of times I'm learning what the issues and trends are from what the students are telling me.
Yeah.
And
Now you're the type of instructor that will adapt to that, though. I know you are, right? I hear the opposite stories from my
oh,
tutoring students where they'll come and they'll say, "Hey, my instructor insisted in lecture that the treatment was like they would say they insisted the treatment was." Blood infusions or
yeah.
whatever. But my
But
textbook said iron infusions, but then on the test, she marked me wrong because she said it was blood transfusions. And
mm,
so I have to negotiate. I have to teach the students how to study to think like a nurse, but
mhm,
then also how to jump through the hoops sometimes of some of those, old school professors that are still kind of teaching based on their experience, even if it might be outdated
yeah,
and aren't as flexible to do things. And then I say, and then you got to know that when you get to NCLEX, they're going to be testing you on the most up to date stuff.
yeah,
Now, chances are you're not going to get a specific question about that one little detail,
yeah,
right? Which is good, but you know, to know for practice about always how to evaluate, and to assimilate new information and to remember that incident so that they can not be that way in the future, but
yeah,
they can be more like you and be like, oh, okay, this is new, and then kind of assimilate it. Yeah.
yeah, yeah. And then as you were talking too, it just kind of reminded me to another part of where I find issues with just in nursing academia is this notion of everything in the textbook is right. Everything in the
Mhm.
textbook, but no, the textbook was written in 2020. 2023, let's say, right?
Right.
Things have changed. And, even if, and so, like you said, we have to be able to adapt and be flexible and keep up with the issues and the trends that are happening. And that's not always going to be reflected in the textbook or the test or
True.
the exam.
Very true. Yeah.
And so even as a professor, I mean, in my practice, when my class writes an exam, I go through each of the items, each of the questions, and look at how each question performed.
Like statistically, right? Yeah.
Right? So did 70% of the class get this wrong? Okay, well
Mm.
then that means must be something wrong with the question, the way it's worded, or maybe the actual answer is incorrect, or maybe there's a discrepancy between the textbook and what I said in class, or so I actually go through the test or maybe it's, well, that isn't relevant anymore. That isn't best practice, and we just didn't modify the exam yet, right? Um, some instructors don't do that. And that's another, like insight that I'll share with students. Some instructors don't do that. They look at the marks and, display them and post them without actually going through the exam in detail to look and see if in fact there were some unfair questions. And
Mm-hmm.
yeah, a lot of students appreciate that because the 1 or 2 bonus marks they can get by,
Oh,
removing
yes. That
questions.
can make the difference between passing and failing for
Yeah,
sometimes.
yeah, you're right.
Yeah.
Yep, definitely can.
Yeah. So speaking of, going through the test results and marking tests, how do you like marking tests?
Oh, oh, Nicole, I love no.
Yeah.
Marking and assessing and evaluating is probably the worst part of the job. I'll be honest. Like for me, maybe some other instructors like it, but
I doubt it.
most of us most of us get into education because we like teaching. We like
Yeah.
learning. But the reality is assessment and evaluation goes hand in hand with teaching
Mm-hmm.
and learning,
Yep.
right? So all your scholarly APA style papers and stuff, yeah, they marking those things they're not fun. Okay, they're not
Oh,
fun.
no, it's boring.
No, it's boring. And lots of instructors will say, they'll sit down with a glass of wine or two
Mm-hmm.
or
Trying to make
three,
it a little bit better.
make it a little bit better. But it is grueling. It is not my favorite part of the job. But it's probably the most important part for students. Like they
Mhm.
want to get that feedback
Yes.
ASAP. And they want to get constructive feedback, right?
Mhm.
Not just very good, or this this is unsatisfactory. It's not only just the grade, but the type of constructive and effective feedback that
Yeah.
you provide. And not a lot of instructors are good at that either.
Nope.
That's
And
another thing.
that's really what turns it into like it transforms something from potentially just being busy work to actually being a learning experience
Yes.
when they can get that. Like I met with one of my regular one-on-one tutoring students yesterday, and I knew you were going to be talking about this point. And so and she had something happen to her that I'm like, I'm going to listen to this podcast episode when it publishes because I'm going to be anonymously telling your story. And she was like, "Oh, I can't wait," because she has these like concept map templates sort of
Yep.
things. Which, oh gosh, I have such a love hate relationship with them.
Concept.
The concept maps I love. I just rarely see them well executed in nursing school programs. So because of that, I have tutoring students come to me who are like burnt out on them and say they are worthless. And I'm like, it's basically what the silver bullet study system that I teach is the idea of a concept map of things flowing. But I don't call it that because I know nursing students hate it by the time they find me. But she was getting these templates. And one of my favorite activities to do is to go through the templates that they get and like label them with the 4 steps of my silver bullet study system. Because you can see then where the gaps are in the
Oh,
templates that they're being assigned sometimes. So why they're maybe not helping as much as they want. But anyway, hers was like this big dense thing. And she would sometimes get like 9 or 10 of them assigned for each unit that had to be done. And she would do those, she would turn them in, and she would basically, it was almost just like a pass fail. Like it was like you did it or you didn't. And
Yeah.
so we went through one of them in her one of her tutoring sessions just because she's like, I need feedback. She's like, this is what my next test is on. I don't know if I know the important information or not.
Mhm.
And when we went through it, first of all, the way it was designed, it was really hard for her to like it was like I call it spaghetti brain. It's like having everything in there and you can't figure out which noodle you're supposed to be eating. And that was really evident. And so we were able to like pick through and show like see how you are missing some important things here, but you obviously you wouldn't have known that because it's just kind of like throwing mud at the wall and seeing what sticks. But yeah, that was her biggest complaint was that her instructor would assign all of this work, but then she's like, I feel like she doesn't even like grading them. Like she doesn't even read them. She just says, okay, you did it. And we get credit for trying, which is nice for your grade,
Yeah.
but not helpful if you want to continue in your nursing program because it's not necessarily going to help you with your exams or your nursing knowledge.
Yeah. And that's partly too the way the course is designed as well. Like I wonder how many marks that concept map is. Is it like 1% of the,
Right.
you
It's
know,
probably not worth that much time.
probably
Yeah.
not,
For
which
the
is why
teacher.
the instructor probably doesn't invest a lot of time to provide that feedback. So you take that into account as
Very true.
well, right? But if an assignment is worth like 10, 20, 30%, then I feel that it's only the right thing to do because students put in a ton of work, or at least most do, um, a ton of work into it, a lot of brain power, and so the least you could do is provide effective feedback, constructive feedback,
Yeah.
and not just nitpick, grammar
Right.
and spelling, but just
Oh,
like what's the thinking behind it? Like how
yeah.
how did you come to that conclusion? What else can support this idea? Like that type of thing. And so, but a lot of instructors aren't very very effective feedback givers, right?
Mm-hmm.
And they know how to teach and they know how to facilitate learning, but in terms of assessing and evaluating students, they don't always have those skills.
Yeah.
Other than just check, very good, it's done, or you did really well on this, or you met all the rubric criteria. But anything beyond that, they may struggle with.
Yeah.
So
Yeah. I have a theory about that
what's
actually.
that?
I don't
What's
know if
that?
you've ever heard me talk about it on TikTok or otherwise, but I have a theory that it's the expert to novice problem. That when you're an expert, I mean, there is research that shows that when you're an expert, you are notoriously bad at remembering what it was like to think like a beginner.
Yeah.
But you think that you're good at remembering. Like you think you remember, but you've lost all that nuance. And so I always use the example of like when you learn to drive a car. We've driven a car for a few years. If somebody hands us a key and says start the car, it's a one-step process because we're
Yeah.
experts in car driving. But I've got an almost 15-year-old who's going to be learning how to drive later this year. And he's, if I handed him a key and said start the car, his eyes would go wide. And it's like 100-step process now, right?
Yeah.
He has to know all the bells and whistles, how to adjust mirrors and cars, which guess what? You and I did that when
Mm-hmm.
we turned the key, but it was so automatic that it was like we didn't even think about it. It was just it had become a one-step process.
Yeah.
And I see that a lot in nursing school, like in the students' experiences, because they are thinking as beginners. And so they don't have some of these connections that happen so automatically for us as educators that sometimes it can be very easy to like think, oh, how did you not know that? Right. Or to have difficulty breaking down the feedback of like they're not connecting something, but I'm not sure what it is. All I can say is wrong. you
Yeah.
know
All I can say is wrong.
it's like it
Yeah.
comes down to like metacognition, being able to think about how you think, which
Yeah.
is again also notoriously hard to do. That's why I've like basically I feel like that's what I've specialized in as a tutor is to try to take myself back to that as much as I can. And I still don't even get it right all the times,
Mhm.
which is why I try to, you know, keep my pride down.
Well,
Just
that's just it. Like as you were talking, it's kind of in order to do that, to bring yourself from expert, not that we're always the experts and everything, but
Mhm.
to to bring ourselves into the mindset of the learner, right? Like how would the learner best want this information to be presented to them in a way that they understand, right?
Mm-hmm.
And so how do you humble yourself to do that every single time? It's hard, and in many ways it's being around and with students and thinking about hearing about what they're thinking, that kind of brings you, oh, okay, yeah, I can't think of it up here, I have to think of it from their lens,
Yep.
right? um, and so yeah, and that's how I would assume, similar to your work as a tutor, as an educator, when you're approaching a topic, you want to be approaching it from that learner perspective, right?
Mm-hmm.
Like, for example, if I'm teaching how to give an injection, like, okay, I'm not going from, drawing up the medication. I'm going to, okay, let's look at the syringe. Let's look at the different parts of the syringe. This
Yeah.
is the plunger. This is the like, but taking it back to that, usually you wouldn't even think that, because you just
Like,
be picking up the syringe and knowing what to do with it. But
that's the
coming back.
equivalent of starting a car. Yeah.
Exactly, right? Exactly. So, yeah, it's similar how your world and my are very,
Yeah.
there's a lot of parallels.
Yeah.
For sure.
Both
Yeah.
nurse educators for sure. Yeah. And I think too, also having a variety of people. So one thing that's different too about being a nurse tutor like I am versus being in a nursing professor position is that you tend to have larger groups that
Mhm.
all have different learning styles,
Oh gosh, yeah.
you know? And so how challenging is that to deal with?
It is challenging because I'll be honest, most of your instructors will teach the way they like to learn best.
Mm,
We resort, and by default, we teach the
absolutely.
way that we like to learn. And we
Hmm.
just assume that it'll work. Okay, so I'm a visual learner. I assume that most of my class are visual learners, and so I have lots of videos and graphics and all of that stuff, but it may not be effective for the auditory learner, or the so um that's one of the issues too, is that I don't always know how my students like to learn best.
Hmm.
We don't often ask them, and sometimes students don't even know.
I was just going to say sometimes they don't even know themselves what their best learning style is. Yeah.
Yeah. So, like, in your work as a nursing tutor, do you actually go through that, like how the student best learns?
Sometimes I
Okay.
kind of do it on a case by case, but it does come up frequently.
Oh,
I haven't done a formal study of this, but I have this general sense that the majority of people that end up working that find me that are seeking help, I
yeah.
think I have a bigger majority of tactile learners
Mm,
than auditory and visual. And I just have my sneaking suspicion that it's because of the way our traditional nursing education system is set up. Because the stereotypical story is they are doing great in clinicals.
yeah.
They know they can do a nurse, but they're just getting hung up on the academic side of things with the tests and the lectures, and they just don't know why, and their teachers don't know what else to tell them, and they're doing all of the things that they've been told they should do, and they're really just starting to doubt themselves. Like
Mhm.
they've just lost their belief in themselves, and they're almost lost their hope. And that's where I get to come in and be like, explain it to them, to be like, no, it's not you that's broken. It is the educational system. This is a big problem with just our Western educational system in general, because it is very much set up for, you know, the auditory and visual learners.
Yeah.
And
Yeah.
clinical obviously is a very hands-on learning environment, which is why they tend to excel in clinicals and skills
Mhm.
lab and things like that. But then it's helping them learn to take the academic side of things and adapt it to their own hands-on learning style, which can be done. It just requires active learning strategies. And that's what I find I end up talking more about with my tutoring students, is the difference between active versus passive learning strategies. I think I
Yeah.
have another podcast episode about this if anyone's listening and wants to
Yeah.
hear me talk more about that. But because I find that regardless of your learning style, active learning strategies are going to cut through like
Mhm.
learning style and be effective no matter what. So that's usually what I will focus on for them.
Yeah. It brings it to life, right? It's one thing
Mhm.
to read it on a lecture, the slides or in your textbook, but when it then translates into an active learning activity, that's where the deep learning happens, right?
Yeah.
As you were
I
talking,
call it wrestling with the information. I'm like, you got to find a way to wrestle with the information, and that's how you're going to remember it and understand it better. Mm-hmm.
sorting through it and applying it. Yeah, absolutely. And that's what the NCLEX is all about too, right? It's
Mm-hmm.
deep learning, that higher levels of thinking. If we think about Bloom's
Yep.
taxonomy, right? It's the upper part of that triangle. And you know, in nursing education, your instructors are expected to integrate that into their teaching, but they don't always do because they don't always know how.
Right. Because it's more difficult.
Yeah,
It's more difficult. Yeah.
yeah,
And I always say, like, because of the way Western education is typically done, all the way up through, you know, secondary education and college and into nursing school, uh, it is very much like passive, and it's those lower levels of Bloom's taxonomy,
yeah,
but they still look like multiple choice questions, which you still get in nursing school, which is why it can be such a rude awakening, because you're like, why are these multiple choice questions? Like, I used to be happy to see multiple choice questions because those were the easy ones versus essay questions. And now
yeah,
in nursing school, they're like the bane of our existence. And I
yeah.
remind students, I'm like, you think they're hard to answer? You should try writing them. I'm like,
The
writing, and nobody
questions,
likes writing them.
no, they are tough. I've had experience writing NCLEX questions, just as a, you know, as a freelancer, and man, some of them I'm like, I don't even know if I would get this right if I was a student,
I know,
right?
right?
So yeah, it's a fine balance, because at the same time, students want the content. They need the
Mhm.
content, right? And it's a whole lot of content you got to cover. But then it's also about how do you bring that to life in an active way, so students not only remember, but they can apply it and engage in that critical thinking and that clinical judgment. Um, but sometimes as an instructor, I'm not going to lie, there's a lot of pressure to just get the content out, you
Yeah.
know, just get it out there, and cover it like a checklist. The
Yes.
boom, 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 right? Without really thinking about, are students getting it? Like, are
That
they
sounds
understanding
yeah.
it?
That sounds like the same problem that students have, just from the other side of the mirror, because they're often, you know, they'll say, "Oh, I don't have time to study with the silver bullet study system because I have so much time to study." And I'm like, "Really? Is that working for you?" Because
Yeah,
because when you go through studying all the content, it's that boom, 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 like checklist, and
yeah,
you feel like you've accomplished so much,
yeah,
but then it's not getting you the results you want because
mm,
it's not in alignment with how you're being tested. Like, the way that students study is largely not in alignment with how they're being tested. And so what I hear you saying is that it's kind of the same on the instructor side, that you feel this pressure to get through all this content, and it's a lot easier to like have a checklist basically that you can check off and be like, "Yep, I talked about all this stuff."
yeah,
But in reality, like, that stuff, even though it's important to know, is not what's technically being tested on. What you're being tested on is always how to think about that stuff. And
yeah,
that is such like a much more abstract concept.
yeah,
You can't put that on a checklist. It's more like it's a way of thinking, and you
yeah,
can't put that on a checklist. So it's hard to like put it in a nice little box and work on it in class. Like, I see this a lot of nursing programs. I've seen a movement towards moving towards more concept based programs and also flipped classrooms.
classrooms, yeah,
And so where the lectures are recorded and like the content stuff is supposed to be done by the students ahead of time, and then the classroom time is for those deeper learning activities.
yeah,
And I hear some nursing students complaining about that, because no, I think it's because nobody's taken the time to explain it to them why this is can be a better way of. See, that's the thing. It can be terrible if it's not implemented well.
true, yeah,
But if it's implemented well, this really is the best way to learn, I think, because it gives you the opportunity. It gives the students an opportunity to practice their critical thinking and their clinical judgment and how to think like a nurse, the way that they're going to actually be tested for NCLEX. So,
mhm.
yeah.
if they do their part and do the
If they
study,
do their part. Yeah.
right? The study, because I hear, even though in theory research has shown that that's an effective way for that
Mm,
deeper level learning, students always tell me, no, I just want to come to lecture and sit there
yeah.
and you tell me what I need to know, right? They want the lectures, but at the
Yeah.
same time, so but we know that's not how learning happens.
Yeah.
So it's like this balance of, okay, where do you go? Do you go
It's a push and
total just
pull.
classroom, or do you go total just lecture and traditional, lecture style? And so as an educator, there's that fine, and that's why I always ask my students, how do you guys want to do this? Do you want me
Mhm.
to just lecture at you, or do you want a bit of lecture and then a bit of activity at the end? I'm comfortable doing that as an educator, especially with a course that I've taught before, because I
Right.
I can
You can
adapt.
flex.
I
Yeah.
can flex. But for some newer educators, no, no, no. The way they have it in their lesson plan, it has to be that way, right? Um,
Right. Especially
so
if they're not comfortable with the material yet. Because
yes,
they
and
haven't
you're not
learned
the
it. That's
expert.
right.
Yeah, yeah, exactly. So no, that this is really good. You're bringing to light a lot of truth from the student perspective, and hopefully, people are learning a little bit about the educator perspective as well.
Yeah.
So
No, I think it's good. I think that like the summary is really that the instructors are out here, they're doing the best they can. Nobody gets into like teaching for the money.
no, quick to say that. No, no,
Nope.
no.
And they're, nursing is a helping profession. And even in the education side of things, the professors still want to help the students. But sometimes I think it just gets lost in translation because of frustrations and all of the push and pull and competing expectations. I think a lot of times the professors and the students have different expectations
Yeah,
about how the education process is going to go. And I think at the end of the day, like communication, empathy, and just approaching everything with the spirit of expecting the best outcome, like assuming the best of each other is always going to be the best way, I think.
yeah. And I think it goes both ways, because I understand, students, they may require extensions and things. Don't Life happens,
Yeah.
right? And for your instructors too, life happens too. They may not have been able to do all the prep that they would have wanted, or marked your assignments
And giving
in.
good feedback. Yeah.
Yeah, right. Because life happens, but if and that's, like you said, where communication can go a long way, and sometimes though that can be uncomfortable for educators to let down that guard a little bit and
It's
show that,
vulnerable.
yeah, that you are human. You're just trying to get by just as much as the students are trying to get by, right?
Yeah.
So, and that's why I think it's important to have conversations like this, so that students recognize, like, profs we're humans too, right? We're trying to do our best with what we have and with what we know. And yeah, and I think a little kindness can go a long way.
Absolutely. For everybody. Yeah. So I have
Yeah.
one last question for you, Justine, that I forgot to tell you about ahead of time. So I'm
Okay,
just going to
throw it
spring it
on.
on you. You ready? You
Yeah,
ready?
yeah.
Okay. If you had one piece of advice that you wish every nursing student could hear, what is it you would tell them?
Mm.
I have a whole series that I did when I very first started my podcast the first time. I reached out to a bunch of people and asked, "What's your best advice for nursing students?" And so it's something I always like to ask. But since it's been a while since I've done an interview, I was like, "Ooh, I remembered it while we were talking." I'm like, "I'm going to throw that at you."
This is a throwback question then.
Yep.
One thing, it's worth it.
Mm,
It's worth it, and it's hard, but it's worth it. And it'll challenge you, it'll change you, it'll transform you. All the struggles that you're going through, the frustration, disappointments, the highs and the lows that come with nursing school. Um, we've all been there. We've all kind of made it out. Most of us made it out, and it'll be worth it, because the opportunities that are going to be out there for you later on after you're done are endless. And you're going to look back on your nursing school journey and think, oh, okay, yeah, it sucked when I felt that way.
Yeah.
I understand now. It's made me more resilient. It's built more skills. It forced me to reflect on what I was doing right or wrong. So there's there's purpose in the struggle.
Hmm.
So I want students to keep that in mind. Like it's worth it. It sucks in the moment, but keep your eyes fixed on that end goal, because it does get better and it will get better.
Yep. Play the long game and remember
Yeah,
the long-term goal, right?
that's that's right.
Good advice. Okay, Justine told me in preparation for today, she has a special offer too that she wants to give away for coaching or mentoring you nursing students. So I'm going to let her tell you a little bit about what that is and how to get it.
All right, thanks, Nicole. All right, so here's the giveaway. First 10 nursing students. If you are struggling with a nursing instructor, if you are struggling in a course or with grades, or not sure how to approach your instructor, not sure how to navigate nursing school, not sure about what your career might look like after nursing school, I am offering free 30-minute coaching or mentoring sessions. You can book a session on my website. Go to itsjustlikeThat.ca. And like I said, first 10 nursing students will get that free service. And I can't wait to meet you.
Yeah, awesome. Thank you so much for offering that. I know that's going to be really valuable for my listeners. And because, not every nursing school has those positive, upbeat, encouraging nursing professors like you. And unfortunately, there are still, because I hear the stories and you get all the people that are having a hard time, right? And there are unfortunately still a lot of instructors out there who are burnt out
Yeah.
and take it out on the students. And there is still some that believe in that old, nurses should eat their young sort of thing, which we do not believe in. And we
No.
are working to change 100%. So if you have any inkling that, you just need some encouragement, I would really encourage you guys to take advantage of Justine's kind offer and book that 30-minute free coaching and mentoring session to get some help on just navigating nursing school. Because just like when you go to the doctor, you don't always know what the doctor's going to tell you. That's why you go.
Yeah.
So go talk to Justine and get her special expertise to help navigate whatever coaching or mentorship problem you're dealing with in nursing school. So thank you for that.
I appreciate it. Thanks, Nicole. I said,
Yeah. Well, thank you so much for sharing your wisdom and giving the perspective of a nursing professor who cares. I
oh,
appreciate that,
thank
Justine, and I
you.
know my students will get a lot out of this. Now, if anybody wants to find out more about Justine and her website, Just Like That, where she helps coach and mentor nursing students and nurses to have a wonderful career and a well-balanced life, you can find her online at itsjustlikeThat.ca. I'll also include all of these links in the show notes for today, so you can go there and check them out. She's also active on Instagram, TikTok, where we met and we're friends, Facebook, and YouTube. So one more thing before we leave, I just want to remind y'all, if you get value from this podcast, please go to Apple Podcasts and give me a 5-star rating and a review. I love hearing from you. I love hearing the comments that people say about what they've gotten out of the podcast and the things they've learned and the encouragement they got. So until next time, good luck on your nursing school journey.